Welcome back to Tech Sheck. And today we have something super special for you. It's been a year for Tech Sheck, and we have the privilege of having our first guest back in April of last year, back again. And guess what? They're moving right along. Great stuff happening. Welcome back, Dr. Sara Saeed, Dr. Iffat Zafar. Lovely having you guys back with us.
Thank you, Farouk, and congratulations. It's been an year for you. We're so happy. And I think you've done some amazing shows over the year. So many friends have been covered by Tech Check, and I think it's become a huge deal for the entrepreneurial ecosystem in Pakistan. So congratulations.
Well, thank you
I think it
guys.
has that connection between the US diaspora of Pakistani entrepreneurs and the Pakistani entrepreneurs. So congrats on that for connecting or building that connect.
Well, I appreciate that, ladies. The journey started for both of us from that day, and we've crossed 60 episodes. And the best part is where Sehat Kahani has come in the last 1 year. And with that, I was recently reading that you guys just raised a very large amount of money to keep growing. So tell us what's going on.
So I think when we were standing here last year, we had a lot of aspirations for the year to come. We had just started our fundraising round officially. So 1 year down the line, I think the best thing that has happened is that people realize the value of virtual healthcare in Pakistan. I think we have positively changed that narrative where people used to think that healthcare can only be provided by a physical doctor. I think we've successfully changed that narrative over the year that healthcare can be provided by a virtual doctor as well. So I think last year we were at around 20,000 downloads of our application, and COVID has had recently come in Pakistan, and we had recently collaborated with the federal government to provide services across Pakistan. That collaboration lasted 6 months. We were able to provide 65,000 consultations to patients for GP care, for specialist care, for mental health care. We created the first mental health consortium for COVID 19 in the country with four other organizations, including AKU, The Scheme, and Saya Health.
Awesome.
Um, we were able to launch our corporate healthcare model, and we were able to provide annual subscription plans to corporations in testing times to provide good quality online healthcare to their employees. And I think from 20,000 downloads, we are now standing at 170,000 downloads. We've done over 250,000 consultations in a year. We've gone from 8 corporations to 53 corporations. We've integrated our solution into two major banking apps, HPL and Alphala. We have signed with the largest insurance provider in the company, the first of its kind partnership between a telemedicine company and insurance provider to provide online healthcare to 700 corporates insured by that insurer. Um, and very interestingly, we work with the government on some very interesting initiatives. So one of those initiatives is that we launched our tele ICU product, in which our solution is being provided at 60 public and private ICUs across Pakistan to connect junior doctors to senior critical care consultants, which is another issue in the country where we only have 70 critical care consultants. We launched a free helpline for patients who do not have a smartphone in collaboration with Lifeboy called Hello Doctor. So
Oh,
people with
wow.
feature phone can access our service only on a missed call. We partnered up with the Ministry of Narcotics and Control to provide mental health services to young people who fall under drug addiction in the country.
Mm.
So I think it just shows that a startup or early stage organization was trusted by many different stakeholders in the country, such as the government, the corporations, the development sector,
Mm.
and in the end, investors. And because of this growth, I think we experienced a 525% growth in our impact, and that helps us close our pre-series A round.
That is awesome. Wonderful news. And no doubt you guys have been very busy in activating yourselves and integrating into the environment there. That's fantastic. So tell me a little more now. Now that you've kind of reached this platform, and you're seeing the world at a different level from where you are now. What's next?
I think what's next is that this partnership that we have with Jubilee. So this is very important. I think right now we are one of the leaders in the corporate segment in Pakistan pertaining to telemedicine. And now we're looking at scaling nationwide. So as many of you already know, we have a network of e-health clinics. Then we also have a mobile application. And the idea is that now with this investment, we want to scale this up. We want to enhance the user experience further. We want to expand our doctors network. The doctors network, by the way, has already expanded to around 5,000 PMDC licensed physicians now. And now we're looking at further expanding it. A lot of doctors from the US, from the UK, from the Saudi Arabian segment have joined Sehat Kahani network. So that's what we are looking at. We're looking at enhancing the government collaboration that we currently have. So for example, our application is also integrated with the NIH platform, which is the Ministry of Health. And now they can route patients towards the Sehat Kahani platform. As Dr. Sara was mentioning, that we partnered with the Ministry of Anti-Narcotics. So that's very interesting. I think where we are providing mental health services to people through a helpline. So the idea is that with this investment, we really want to scale this up. We want to focus on marketing so that more and more people from the mass market can actually access this product. And ultimately, we also want to scale regionally. So we are looking at how this can actually be scaled further into the South Asian segment. So that's something that we are looking forward to and hopefully very excited about it. I think we are those crazy people. We want to make this a success story out of Pakistan. That two women doctors who have made this not only a successful organization in Pakistan, but also in the South Asian region. So, just briefly, if I were to summarize, I think this is what we want to do. We were also targeting 2 or 3 other insurance providers. So ultimately, hopefully being one of the leaders in this segment. Yeah.
That's awesome. Well, you guys have definitely made an impression, right? So that's all moving in the right direction, and we're very happy to see that. It would be
Being on fire.
well, the good thing is that things are moving in the right direction, and we can't say that COVID was a bad thing necessarily, right? It actually ended up probably helping you guys in some ways. So with that, oh, go ahead. I know you wanted to comment there.
No, I think COVID obviously for a third world country where healthcare system is already fractured, we have enough trouble dealing with the health issues that are present in Pakistan. But I think when COVID came in the country, I think one thing that me and Iffat knew was that if there was any time to prove that telemedicine can work in Pakistan, this is the time. Because if we can't convert patients right now, we won't be able to do it anywhere later. So we kind of grab this opportunity and make sure that anywhere, wherever people needed telemedicine services, whether they wanted it themselves, through the government, through a corporate, integrate in other platforms, it's the solution is just there for them to have and access. And we didn't just focus on providing the solution, we created a lot of pathways to get feedback from patients as well. So one very interesting thing that we did was we established a call center, which is now a 12 people call center. It's 24/7. But every patient who called, who had a consultation at the Sehat Kahani app, got a feedback call from our call center within the day to have their feedback noted.
Wow.
Every missed, cancelled, or dropped call was called back within 2 to 3 hours to get a chance for a consultation again. So that really helped us getting that credibility and trust from the customer that we are not just an application that is going to help them connect to a doctor. We really do care for each and every patient that is coming onto the platform, and we will make sure that one way or the other they are connected to a doctor. We had patients who couldn't access the app for some reason, for some technical reason. We connected the doctor on call with them because we said that connecting you with the doctor is more important rather than you using the app. So I think that gave us a lot of trust and that gave us a lot of positive feedback that helps us move forward.
That's
I
fantastic.
think another thing that I'd mention here is that this year, finally, we also were able to venture into Balochistan. So we always
Yeah.
wanted to be able to create healthcare access in that one province. And this year, we finally were not only able to go into Balochistan, but also create good, substantial relationships there with the government sector. So I think that has been very positive as well.
That's fantastic. Well, you know what, guys? It's so, ladies, my apologies. I keep defaulting to that. It's really wonderful to see where you guys are going, how you've achieved what you've achieved, albeit during a very difficult time, not just for Pakistan, but for us globally. But as they say, sometimes these situations create opportunities that we never really thought of or dreamt of. So very happy to have you both back. And the best part of all of this is that after a year, there is nothing more satisfying than knowing that by telling these stories, we really have our first guest flourishing and growing and doing much better. So, and with that, as you know, we never try to keep these too long. We want to make them short and informative for the audience out there. Uh, I want to thank these two young women. They were very instrumental in me starting Tech Sheck because when I met them a couple of years ago, I was really blown away by the level of talent and ambition we have in Pakistan, especially with our doctor brides. And you guys have really, really set the pace for changing that perception and moving things forward. So thank you both very much for that in and of itself.
Thank you, Farouk. I think people like you and everyone who supported. I think wherever we are today, we couldn't have done it without a very strong support that we get from the Pakistani ecosystem. It's a small community, but it's a trusted community where everyone wants to help the other person, and we were only able to get here because so many supporters and mentors along the way. But thank you very much. I think you connected us to so many people over the years, so it wasn't just an episode that you did. I think the communication and the help was way beyond that. So thank you for everything that you did for us over the year.
Well, much
I think
appreciated.
the best part of working with you has been the fact that it's not just coming on video doing this session. I think the relationship that we've built over time, how you have supported not only us but so many other entrepreneurs and the growing ecosystem within Pakistan. I think that's been phenomenal. So thank you so much and best of luck for Tech Check. We're really hoping to see 1,000 episodes hopefully, and someday you want to come back to Pakistan, maybe do some episodes here as well.
Yes, and then
Absolutely the
we can
plan.
interview you sitting in our office.
Yeah,
Well,
absolutely.
I,
We should
I'm
do that.
looking very forward to that day. And that day is coming sooner than later. So, yeah, we're going to be happy to continue doing these types of activities. And I think there's another chapter for Tech Check opening up in all of this is that we continue to share and build on the success stories. That's where the proof is in the pudding, especially for people here in the diaspora. So
Great.
with that, I'd like to wrap it up, ladies. Again, thank you both very, very much for your time. I know you guys are really busy right now. I'm glad you could come on with us. Thank you again, and again, thanks for supporting us along the way.
Thank you. It was a pleasure being here, and I cannot believe a year has passed.
I can't either, but I'm definitely ready to come visit you guys. So, inshallah, that's going to be happening sooner than later. And and with our audience, so here you have it, folks. 60 episodes in, the ladies we started with. I got to stop saying that. The ladies we started with, look where they are now. So you know what? Step in, see what's happening, folks. Do the research. There are good things happening in Pakistan. We got to keep building on this positive momentum. Let's not focus so much on the negative. And with that, we at Tech Sheck need your support. Please like, share, subscribe, follow us. A lot of people give me a lot of feedback, but I don't get the kind of spread and circulation. And we need to do more of this, folks. Let's focus on the positive things and what's going on that's doing well in Pakistan. And with that, I bid all of you Allah Hafiz.
Allah Hafiz.
Allah Hafiz.